Hi, Surabhi. Thank you for joining me.
Thank you so much, Jaita, for having me. I'm excited to have this conversation today.
Yeah. So, for the audience, I'm joined by Surabhi Veitch today. She's a physical therapist and she's also a prenatal and postpartum fitness coach. She has been in practice for a little over 14 years now. And today's episode is all about pelvic health, but we'll also dive deep into how our pelvic floor changes during pregnancy and what all other things that can help pregnant women while they are in that phase. So, Surabhi, thanks a lot for joining me once again. And before we talk about how our pelvic floor really changes during pregnancy, for the audience, let's just give a basic understanding of what pelvic floor physiotherapy is and how it can help.
For sure. So, a physiotherapist helps with any kind of injuries, bone, joint, muscular, nerve. We help you feel better, improve your quality of life, return to exercise, dance, sport, even just activities of daily living if you can't bend over to pick up your kids and your back hurts. So we help with all of those things. Now, pelvic floor physiotherapist has additional training in the pelvic health field. A lot of physiotherapists who go to school and graduate, they don't know anything about the pelvic floor. So if you're peeing yourself, if you're constipated, if your pelvic floor hurts after having a baby, if you have scar tissue, if you have a C-section or diastasis recti, which is abdominal separation, they won't know how to treat it. And so a pelvic floor physiotherapist has additional training to help treat those conditions as well as everything else in your body. I treat both pelvic floor conditions as well as orthopedic conditions like shoulder injuries, neck, back pain, ankle sprains, and such. So I kind of treat the whole body.
Mm-hmm. And when you talk about the prenatal and post, like your prenatal and postpartum fitness coach also, right?
Yes.
What does that include?
So as a fitness coach, I help people get strong, help with improving their mobility. I received additional training in specifically pregnancy and postpartum athleticism because I found that a lot of physiotherapy school, we don't learn a lot about exercise. You'd be surprised if you don't. You know who knows a lot about exercise is fitness trainers.
Yeah.
And so I liked marrying the two, fields, physiotherapy and fitness training, so that when I work with my clients, I don't just help them do Kegels and sit around, doing Kegels. I actually help them get back to the things that they want to do.
Yeah.
I'm a dancer. I can't dance and jump and, squat if I don't actually do those exercises. So as a fitness coach, I actually help people return to exercise with confidence and build the strength and feel more athletic through pregnancy, postpartum, and in motherhood.
Mm-hmm. So, you talk about how you have clients who are pregnant and who are in the postpartum phase. But I just like to understand first that what is the level of awareness? Because honestly, I am guilty. I did not know that there is something that like a pelvic floor physical therapy that can help during pregnancy and after pregnancy. And I figured out when I was still pregnant. But before that, even though I thought like I'm doing a lot of homework and preparing myself, I did not have a very good idea about this. So what is the level of awareness you would say in North America in general in women?
It's really tough to say. I mean, you live in Toronto GTA and you still didn't know. So you can imagine any small town, they probably don't know.
Yeah.
We just assume, right?
Yeah.
And even in big cities, people usually hear about it from their doctors. And if their doctors, midwives, or OBGYNs aren't telling you about it, then you either hear it from mom groups or Instagram and TikTok. And so social media has actually been really powerful over the pandemic. Lots of pelvic health professionals joined, Instagram. That's when I started. I was like, well, why not share my advice here? Because where else am I going to market myself? And it has been really powerful because now for the first time, women are taking their own health into their own, account. Instead of waiting for their doctors to refer, they're seeking out pelvic floor physiotherapists. Yeah. They're seeking out prenatal Pilates, prenatal yoga classes. They're not waiting to be referred. And that's what I actually advise most people is be empowered. Your doctor, ultimately, at the end of the day, does not care about your fitness. They care about your medical health. Your OBGYN wants you to have a healthy baby and you to be healthy and alive and well. They don't care if you have a diastasis recti, if you're peeing yourself. They're like, all right, go see a physio. Yeah. And most people in a 5-minute OBGYN appointment or even a 15-minute midwife, half an hour midwife appointment, they're talking about all their concerns with their baby, their health. They're not
Yeah.
necessarily talking about, hey, by the way, sex kind of hurts. Oh, you know what? I've been peeing myself a little bit. They're not usually reporting that. And if they do report it, it's up to, as a good midwife, like all the midwives that I work with, they're the ones that are like, hey, go see Surabhi, But let's say you don't have any concerns. I still recommend people in pregnancy to come in for pelvic physio, because we can help people minimize tearing during labor. Even if they have a C-section, most of my C-section moms who have a C-section who've seen me in pregnancy, they heal really well postpartum because they know how to manage through the C-section and postpartum. They're not as scared, they're not as panicked, and their outcomes are better. So it's like we do all the training for every single thing. We do the pregnancy classes, hospital classes, how to breastfeed. We forget about ourselves. Like, we're the vessel that's growing the baby. Like, we're the most important thing to take care of, right? People are worried about, should I avoid caffeine? Should I avoid or should I not eat fresh fish or raw fish? It's like, those are minor conversations. Let's worry about your whole health first, right? If your back hurts every night and you can't sleep through the night in pregnancy, then that's going to impact your energy levels, your mood, your nausea, and it can potentially also impact your pregnancy, right? So, I help people kind of feel comfortable.
And it's for 9 months we are carrying the baby there. So there's definitely going to be like very evident changes.
Exactly.
Sometimes like you cannot see, right? But you can feel this. And then so my next question was actually, a lot of moms think like pelvic floor physiotherapy is something that we should seek after the baby is born. And they think like, okay, if there's any issue, that's going to happen after the baby is born. But right now, let's kind of, talk about how we have to prepare ourselves during birth. And God knows, maybe we don't have to really seek help in the postpartum if we are prepped well, right?
Yeah. I mean, if you look at birthing, it's only one day. Don't seek help in physio for birth. Seek help for your pregnancy and for better postpartum. Most women these days, I'm going to generalize. Yes, there's more women who are working out these days and going to the gym and going for runs. Fantastic. But by and large, women and men, our society is very sedentary. Women more so, because women from childhood, girls are not encouraged to be as active. And so if we look at just that simple, fact, girls and women are less active than men, then what happens when you have a pregnancy? Are you really going to be prepared for pushing a baby out? To handle the increasing load over 9 months, most women are very, very underprepared. And so I suggest to everyone to get help in pregnancy. Most people won't get help. And it's funny, even if they have the money, they have the benefits, they have the resources, they'll make excuses. I don't know what it is. And for me, I don't like to sugarcoat things. And I'm like, you either want to feel good in your body or you don't. Like, there's no reason not to see a pelvic physio. You're going to hundreds of midwife appointments, OB appointments. You'll go check out 5 different stores for the perfect stroller, for the cutest bibs.
Yeah.
Like, let's be honest. This is not about not having the time, and it's not about money, because I see people with up-a-baby strollers, $1,000 strollers, fanciest car seats. Their baby's teether costs $50. Like, you can afford to put money into your own health. And so I don't know what it is. I think women are trained in our society, and especially culturally, to sacrifice their bodies, sacrifice themselves, and never really focus on self-care, unless it's getting your nails done or getting your eyebrows done, like superficial stuff. And so for me, it's like, we shouldn't have to think so hard about this. It should be a no-brainer. It's like, you're going through a pregnancy. It's like, if you're going to go run a marathon, you wouldn't train after the fact. You wouldn't stretch after the fact. You wouldn't strengthen after the fact. You got to do it before.
Yeah.
And so if someone's listening and they're like, oh no, I didn't go to pelvic physio in pregnancy, I'm like going to be giving birth next week, is it too late? It's never too late. I've had people come in, they're like, I have an induction planned on Friday. It's like tomorrow.
Wow.
Like, what can I do? Because even just having an understanding and preparation mentally and physically, it goes smoother, right?
Yeah. I think more, if like I talk about myself, it kind of prepares you to, let's just say like how to spread your legs, because moms are like so scared, right? You have tension in your pelvic, and that doesn't let you really loosen up when you're in labor. And like you said, like somebody can come anytime, let's say if their labor is Friday. But if somebody wants to prepare themselves well in advance, what would you suggest? What's the best time? I mean, when is the best time to start coming for the first session maybe?
I would suggest second trimester, early in the second trimester. You can come in the first trimester as well. And there's no reason, for example, that we can't do an internal pelvic floor exam, but many people are uncomfortable with it, especially if they have any bleeding or spotting. There's an increased risk of loss, early loss or miscarriage. And so people are not they're nauseous. They're not necessarily thinking about their pelvic physio, pelvic health. So usually people come to see me in their second trimester, early in the second trimester. If I do a screen and they're good, their strength is good, their mobility is good, they don't have pain, dysfunction, and they're already exercising, I will see them usually closer to 32 weeks, because that's usually when we start doing things like preparing for birth, perineal massage, and specific stretches, specific exercises to help prepare. If you come to see me in the second trimester and you have symptoms like urinary leakage or urgency or frequency, you're waking up through the night to go pee, or you're having to go pee a lot, you're wearing a panty liner or pad to catch the leaks, you're not exercising as much because of your pain or discomfort, maybe you have constipation now, which is very, very common in pregnancy, or if sex hurts or pleasure hurts, and those are concerns that you're having, you can come at any time. You don't have to wait till your second trimester. You can come at any point. Many of my pregnant clients come in due to sciatica or back pain as well. So they're not necessarily there for birth prep. They're like, my back hurts, I can't walk, I can't sleep. And then we treat that. And then they realize, oh, you can also help me with birth prep? Amazing. People think it's not necessary, and then they get to the hospital, especially if they have an OB. Especially if they have an OB. They get to the hospital and they just listen blindly to what the OB says. And you have to understand the OB is looking out for your best, your health and your wellness, but they operate a certain way, and they're not necessarily going to walk you through things gently and carefully and give you all the options, even though they should. And so in our day, we need to be empowered and educated to ask the right questions, so that we're not suddenly thrown into an induction or thrown into, oh, I didn't know I was going to have augmented birth. I didn't know I was going to have a vacuum or suction delivery. They gave me an episiotomy. I didn't even know what was going on. You should know what's going on. It's your body. And how many times are you going to give birth? Once, twice, three? It's not many, many times. So it's interesting to me that people prepare more for a 5K race than a birth. And that's something I'm looking to change. I really want women to prioritize themselves. And some people will be like, my husband says we can't afford it. I'm like, excuse me, if you can afford to have a baby, you can afford for your wife or your partner to get pelvic physio, right? I totally understand some people, it's truly out of their budget. But the people I'm talking about, they're just choosing not to prioritize that. And to me, that's really sad,
Actually, a lot of people have insurance that covers this too.
100%.
Yeah.
And what are you doing with your benefits?
Maybe instead of planning 3 different outfits and 3 different locations for your maternity shoot, prioritize
oh my gosh.
this.
You said it. Maternity shoots. I love it. I love people, taking those glorious photos. But I'm like, if you're spending $1,500 on a maternity shoot, you're going to get those photos forever.
Yeah.
But then when your body's broken,
that's going to stay forever with you.
That's going to stay with you forever too.
Yeah.
When you can't jump on the trampoline with your kids, when you can't chase after them. And I don't want people to think it's too late ever. I see women who are in their 60s who gave birth 20, 30 years ago, and they're now rehabbing. So it's never truly too late to rehab, but why not improve your quality of life if you can, right?
And by the fact that they have been kind of suffering for next 30 years. Oh, yeah. And then
that's the norm.
Yeah.
That's the norm. And the thing is, back in our mums and grandma's generations, they were not allowed to talk about it. They were not allowed to complain. They were not allowed. It wasn't normalized to say, "Oh, are you peeing your pants like I am?" It was just yeah, of course you are. You've had a baby. Of course you're not going to go running, or you're not going to be athletic because you're a woman. And so I think our generations are now, there's more equal rights, equal opportunities, which is fantastic, and there should be. And so we're kind of one of the first generations was no, this is not enough. Yeah. I don't want to be a grandma and this typical grandma who sits on the couch and doesn't go for walks and doesn't climb stairs. And, I want to be active as I age. And that starts from the time you're pregnant, Yeah.
Surabhi, I know you mentioned how pelvic health physio can also help in constipation.
Yes.
And there's one, now I feel is it a myth we keep hearing you're taking your prenatals, you're taking iron, and that's the reason that you're having constipation. But what if moms just accept that, I have to live with this when I'm pregnant?
Yeah, they do. They often accept it, and many people are constipated before pregnancy. Many, many people. Most people do not poop daily. They may poop every other day. And unfortunately, the constipation guidelines in North America are, they say that if you poop once, 3 times a day or 3 times a week, that's normal. Can you imagine 3 times a week? If you're eating 3 times a day, you should be pooping at least once a day.
Yeah.
At least. And in our cultures, our food are high in fiber. We eat lots of veggies, legumes, dals. And so usually our cultures, most people don't have that issue.
Yeah.
But people who eat a standard American diet with a lot of carbs, meats, not many veggies or fruit, they're going to be constipated even before pregnancy. Pregnancy slows down gastric motility, so the speed at which things move within your digestive tract. And then when you add in prenatals or iron supplements, which a lot of people take because of low iron in pregnancy, it slows it down even more. And so you need to combat that with something. Movement can help. Fiber, obviously increasing your fiber can help, although for some people increasing their fiber actually can make it worse and cause more bloating and pain. So we have a one-on-one discussion and see what's going to be the thing that helps. Many people also see a dietitian or a naturopathic doctor. I think that's a great, adjunct on your team to kind of help with the nutrition aspect. And then the pelvic floor wise, if they have tension in their pelvic floor, if you think about water coming out of a hose and you pinch the hose, it's going to be harder for whatever it is to come out, whether it's pee or poo, right? So whatever tightness you have in your pelvic floor, it actually restricts things from coming out. So from a pelvic floor perspective, we talk about the fiber aspect and the movement aspect as well as the pelvic floor aspect.
And then these are some symptoms that the moms can feel, right? They will know that, okay, this is something off. Are there
they're
any
going to try to
things-
poop. They'll have pain, hemorrhoids, bleeding, all the things.
Will there be any kind of symptoms during pregnancy in any trimester that is something that a mom is not feeling, but if they come for assessment, you find out that there's something going on, and they'll be surprised like, wow, I did not know.
Most people don't realize, unless they have like really a lot of tension in their pelvic floor, and let's say they have pain with sex, or so many people think pain with sex is normal. They're like, yeah, it's never that comfortable. Isn't that just how it is? I'm like, no, it shouldn't hurt. The same way as when you eat some food, your mouth doesn't get hurt. When you eat a burger or corn on the cob or something, you open your mouth big. Same thing with your vagina. It shouldn't hurt when you're having intercourse or any type of, putting a tampon in.
Yeah.
Some people are so unaware of that they don't have any clue that they have pain or tension in there. That's one of the biggest things. The other thing is people have a hard time relaxing their pelvic floor muscles. We think that everyone needs to do Kegels and get stronger, but it's actually the opposite. Is they need to learn to let go. We live in a very high stress, high paced society, capitalism at its finest. There's lots of pressures, stressors. How can we relax? Most people are not like, they're like high strung and high stress, especially in the city, sitting in traffic, driving across the city. It all adds to more tension. So that's one of the things people are like, I didn't even know I had muscles there. I didn't even know that was a muscle or that was tension. Our vulva's hidden, right? We can't see it unless we have a mirror. And so when we can't see something, it's really hard to visually or even comprehend what's going on down there. So I help people kind of understand their bodies a bit better.
Yeah. And I'm going to ask this question, but I don't want the audience to feel like I'm trying to, promote that this is going to help in labor or progressing labor. But if we have to have that kind of perspective, how does this help to progress well in labor? And then, of course, we are not trying to prepare for birth like a vaginal birth. There could be moms who can still not have a vaginal birth for any reasons, right? How can this help us progress well? And then again, we cannot expect to come today when we are actually in our 40 week and then, expect that, it's going to help me in my labor, right? So somebody who wants to prep for birth.
Yes.
There should be some time, right, that they have to focus or maybe...
Ideally come by 32 weeks.
32.
Ideally. Most babies, if you're going to go vaginally, most first babies are late, past their due date. But that's an average. You might go 38 weeks, 37 weeks. So come early enough that you have time to work on it if you have problems or tension. If your pelvic floor is gold star, everything's fine, you don't have to stress about it. Now you know. But most people have something or the other to work on. Some people are so tight. If you're someone who's always had pain with intercourse, come as early as you can, because it will take time to work on it, right? People often think that everything should just get fixed like that. I'm like, think about any other muscle in your body. If
Yeah,
it's weak, it's not going to
absolutely.
get stronger overnight. If it's tight, it's not going to stretch out overnight. So I like what you said. Give yourself time to prepare. But 32 weeks, I usually say at the latest, come if you can before then.
And there are people who have had painful intercourse like for life, and
Forever.
they think like it's okay.
Yeah.
Because that's like the biggest red flag, that you have tension down there, right? In the muscles or the bones in general.
But it's the same with people who pee themselves, and when they cough or sneeze or laugh, and they think that's normal. And that's even people who've leaked before they have kids. A lot of women leak even before they have kids. So it's just normalized. It's people are embarrassed. And I'm like, hey, there's things you can do about it. It's just like erectile dysfunction for men, or men also may have pelvic pain. You can treat all those things, and there's things you can do to improve. But when we're embarrassed, there's so much stigma around pelvic health because it's, potty, talking about the potty words, or, talking about things that in our homes and our households, the word sex, the word pelvic floor, vagina, vulva, they're not usually uttered.
Yeah.
And so everyone knows what a penis is, but nobody knows what a vulva is. We even call it the wrong name. We call everything down there the vagina.
Yeah.
The vagina is only the canal.
Yeah. Yeah.
Everything is the vulva, what you see on the outside. So I would suggest, most people don't realize that pain is not normal, that leaking is not normal. Though they are very common, they're not normal, and there's things we can do about it. There's no shame to be felt. It's just like if you have a shoulder injury, you're not going to feel ashamed. You're just going to go to physio and get help. It's the same exact thing. It's just a different body part.
Yeah, I hope it's going to get better hereafter. Like, if you see, like, decades ago, when our moms and grandmas, they would be like, shh, you can't talk like that. You can't use these words, right?
It's
Now getting
already
better.
improving. Improving, for sure.
But at least we'll be the cool moms, like our daughters and sons can sit and talk with us.
I know.
About
I
these
say that
things.
now. I'm like, oh my gosh, I hope my kids, like, you always think like, oh, my kids will be able to talk to me about anything, and I hope that they can.
Yeah.
But teenagers are, different. Sometimes they're like, I don't want to talk to my mom about this, but I hope that we're going to be the cool moms who help our kids just feel comfortable asking any question, and just being able to support them through a very, puberty. Imagine how different our lives would have been now if during puberty we were truly well educated about our bodies, about our pleasure, about just our anatomy even,
Yeah. And then let's talk about the vaginal birth and the C-section birth.
Yes.
And here I'm trying to understand, like, let's say our mom had a C-section birth. Maybe she's underestimating the attention that she needs because she did not push the baby out. But anyway, both of them carried the baby for 9 months, right? So let's unpack that.
Yes.
What are the changes here? What are the changes here? And I know, irrespective of what kind of birth it was, you're going to suggest that it is important. But let's kind of unpack that for
Okay, so
listeners.
1 in 3 births end up in C-section, whether it's a planned or unplanned C-section. So I always try to prepare people for the idea that yes, you're planning for a vaginal birth, but it may also be a C-section. And sometimes you don't know until the moment, because maybe they're like, hey, actually baby's breech, or baby's transverse, or you know what, you've been pushing for 24 hours, you're getting very tired, baby's distressed, let's progress this to a C-section. And so sometimes moms will have pushed for 5 hours, or been in labor for 24 hours. So they've had all the pelvic floor, discomfort and trauma. Then they end up having a C-section. So almost every single person, there's very few people that I would say they probably don't need pelvic physio postpartum. And the reason is, like you said, you've carried the baby for 9 months, or anytime, 8 to 10 months. The weight's been hanging on your abs have stretched, your pelvic floor has been stretched and weighted down. And now, despite whether you've had a surgical birth or a vaginal birth, there is going to be trauma to both your core and your pelvic floor, your abs and your pelvic floor. And so in pelvic physio, we work on any scars, pain from the scar itself. We make sure the scar moves well, heals well, so it's as smooth and flat as possible, not as keloid or bumpy, or stuck in pain or stuck with lack of mobility. We also make sure that the person has good control of their abs and pelvic floor postpartum. And then let's say they want to return back to jogging or Pilates or dance or badminton or whatever the sport or activity they want to, they can. They can go for their walks. But many people think, oh, I exercise, I go for walks, I'm an active mom. But walking is not going to strengthen your pelvic floor in the same way that specific exercises would. And so there is value to do at least a small amount, maybe 12 weeks of rehab, exercises, I put it in quotations because it doesn't have to be like boring Kegels. It can be, squats and like regular fitness exercises, but it has to be gradual so that when you return back to your regular fitness activities, you're successful, right? Most people, they're like 6 weeks, I'm cleared. Amazing. I'm going to go for a jog, or I'm going to go back to that workout class at the gym. And the trainer isn't necessarily an expert in pregnancy or postpartum.
Yeah.
And even if they have a certification, for example, I have a certification in prenatal postnatal athleticism.
Yeah.
But just that alone doesn't mean I know all the things I also know as a physiotherapist. So you have to, as the person in the body who's been just, given birth or had a surgical birth, you have to look out for yourself, because you have to assume that the person training you may not know, unless they're truly like a specialist in that time of life. So.
And so the 6-week clearance that we get from our OBs is not necessarily for our physical workout or, focusing on our abs or core.
Honestly, I also think the main reason they do it is because patriarchy, and they don't think men can wait any longer than 6 weeks before they're going to want to have sex. So they're like, okay, fine, 6 weeks is up.
Yeah.
Bare minimum healing has happened. Go have sex, go exercise. The reality is you're exercising from day one because you're lifting a baby and you're carrying them for hours a day. You're probably going to need to climb stairs at some point or get up from a low couch. Any of that can be considered quote unquote exercise. So I don't want you to think until 6 weeks you can do absolutely nothing. You can slowly start to gradually. I usually start my clients around 2 weeks postpartum with very early rehab, again, depending on how their birth has gone. In terms of returning back to sex at 6 weeks, most people don't return at 6 weeks. Some people do, and maybe a little bit easier after C-section, you might think. But when your abs have had a big cut incision through them, everything in your body can hurt. Right? Yeah. Even your pelvic floor. Many people post C-section actually have a lot of tension or tightness in their pelvic floor because now their abs aren't as functional because there's been a big incision and wound that's healing. So now all that extra load of that your abs would take up, now your pelvic floor is having to work double time. And so people end up with all sorts of pelvic tightness and pelvic tension even after a C-section. So some people take months to return back to normal in terms of returning to sex and then returning to exercise. Usually I'd say by 6 to 12 weeks, you should be able to return to a lot of things. I wouldn't jog. I wouldn't go for a run at 6 weeks. Usually the guidelines say wait for 12 weeks. And that's assuming you have gradually done some rehab exercises and then you return at 12 weeks. Yeah. If you've just sat on the couch for 12 weeks and then you're like, 12-week mark is done. Now I can run. That's less, that's not as good of a recommendation.
I think it's also everybody's different, right? Your body is not gonna act same as another person's body. Everybody's postpartum experience is different, and so I remember I was able to kind of do a little bit of stuff in the first week itself. I was taking time that I should not really exert myself that much, but we should not benchmark other moms. And
no, exactly.
Maybe somebody's having a different condition that they can really not do it.
There's tons of people who have, and there's other things. You might have a baby in the NICU. You might have a baby that needs, help feeding. You might not be able to, there's so many postpartum mental health conditions. There's so many barriers to movement and exercise and returning back to kind of those types of things. And I really want moms to not put that pressure of comparison, especially with social media. You might see another mom, a fitfluencer bounce back. I'm like, that's their job. Their business is on how skinny they and how flat their abs are. So don't assume you're going to get like that when you have a seated desk job or you're working as a teacher on your feet all day. Well, how are you going to have time to train like that? And a lot of people who look very thin or, muscly, it's also genetically that they have that as an advantage. Maybe that's their body type. And a lot of people are doing things you shouldn't. Like they're starving themselves. They're barely eating. They're taking weight loss drugs. So don't assume by anything you see online. Don't assume it's a fact. And just because, your doctor says it's okay at 6 weeks, it doesn't mean you have to return to all those things at 6 weeks. You can take longer. You can also take shorter if you're feeling mentally ready and physically ready. The one thing I will say is don't trust yourself too much postpartum, because mentally people are like, yeah, I feel good. Let me go for that 1 hour walk. I feel great, because mentally you still think of yourself as the same person you were pre-pregnancy. But now you're healing there's a dinner plate size wound in your uterus, your body is trying to return to normal. You can't visibly see that, but everything's going on inside. Your hormones are trying to return back to normal. Your breast milk is coming in if you're breastfeeding. And so we need to not forget that there are big things happening within us. And even though we might feel, I don't feel so bad, no need to be a hero. There is no need to be a hero. You can not do laundry for a few weeks. Let your partner help, let your parents help, or whoever. You don't have to rush to get back to cleaning. You don't have to rush to get back to exercise. There's nothing to prove, and there's no oh, look how easy I had it. Like, there's no feeling of that. It's just take it slow. Give yourself time. You'll thank yourself later, because a lot of women who push it a lot in the first few weeks and months postpartum, mentally they get depleted. They're more at risk of postpartum disorder, perinatal mental health disorders as well, right? Because your body only has so much capacity every day. And if you're spending more energy working out or doing things that are maybe not that important in this phase of your life, that means you have less energy for all the other things, right?
So Surabhi, this was definitely not enough. I'm sure our audience would love to hear a lot more from you. And we spoke everything about, not really everything, but we spoke a lot about pregnancy, and we still have to talk about postpartum, and also from your expertise, reclaiming pleasure. We will talk about that later. But
I think that's a whole separate conversation, because it's a huge topic that's not often talked about, because your doctor is not necessarily at 6 weeks asking you, hey, how's your clitoris feeling? Are you able to have an orgasm? Has any doctor in the history of have they ever asked their patients that at 6 weeks? No. What are they asking instead? Yeah, you can return back to sex. And what they mean is intercourse, as if that's your number one priority, right?
Yeah.
That's a whole separate conversation. I really think we need to have that, because it's so not talked about. And I'm like, why are we not talking about this? It's like the whole, that book that says everybody poops. Yeah. Everybody poops, everybody pees, everybody has sex. Why are we not talking about this? There's nothing to be ashamed of. It's just a part of life, and we need to talk about how we can do it in a better way without less pain and with more pleasure and more enjoyment and satisfaction.
Live. But to end this episode, I want to do that on a note for any mom who is probably 3-4 months postpartum, or maybe just gave birth and did not see a physiotherapist for the pregnancy journey. I don't want them to feel guilty, like, oh, this is something so huge and I did not do. Like you said, it's never too late, right?
It's never too late.
What would you say to these moms?
So if you haven't done it yet, there's nothing you can do about it. No point dwelling on it. Some people do come to me, many people postpartum, they're like, I wish I came to you before. If I did, I wouldn't have had this. There's no guarantees. It's not like because you do pelvic physio, everything will go perfectly either, right? So don't put that pressure on yourself. Yeah. I have had patients who've done pelvic physio and they've come out with no tears. They've come out with second degree, less so third and fourth degree tears are very rare, to be honest, especially for people who've done pelvic physio and done perineal massage, which has been proven to reduce the risk of those more advanced tears. So please make sure you're actually doing that if you can. But if you've missed that boat, it's okay. Start where you are. It's never too late. Some people are like, oh, I'm already 6 months. This is too late. I'm like, you're barely postpartum. You're just a brand new mom. You might think you're super, it's been so long. It's only been 6 months. You have lots of time. If it's been 3 years already, you have lots of time. If it's been 10 years, you have lots of time. So it's never too late. I work with a variety of ages. I'm very fortunate because I do work out of the midwife clinic. So I see a lot of moms in pregnancy and postpartum. But I see a lot of moms who have 10, 15-year-olds. And they're in perimenopause now, which is, closer to menopause. And so now they're experiencing different pelvic floor symptoms, right? So, if anybody is in the GTA and needs support, they can email me if they have any questions.
I'll put the website and your socials in the description so that if they have any questions, they want to reach out to you, they want to book a consultation, they can go ahead and do it.
Yeah, www.thepassionatephysio.ca. The Passionate Physio, if you Google it, you'll find me. And you can share the links. And if they have any questions, email is the best way to get a hold of me. Instagram, sometimes DMs disappear. It's harder to keep track of. So, and then I do online consults as well as in person to keep it convenient for people who are new moms and finding it hard to get out of the house and attend appointments in person. So,
Well, thank you so much, Surabhi. This was like a wonderful conversation. It was so insightful for me as well. I'm sure
Thank you for having me.
the audience is going to enjoy this a lot. And like I said, we have a lot more to talk about. We'll
100%.
do that in the upcoming episodes. So for
And
anybody,
for you, I was
yeah.
going to say, as a new mom, I think it's incredible what you're doing.
Thank you.
Like it is really tough, the postpartum phase, and I think you're making, it's almost like you're, from your own experience, you're like giving back to the postpartum community and the pregnancy community, and I think that's beautiful. So
Thank you so much. Really appreciate it. I think when you're in the thick of it, it's the best time and you can do the best out of it, right?
Yeah, everything
Thanks
is
a
coming from
lot.
real lived experience, right?
Exactly. Right. Thank you so much. And for those of you who haven't subscribed, please do so that you don't miss any episodes, because we are going to talk a lot about some of the topics which you don't hear about and are very rarely talked, but you need to know about those topics too. So thanks a lot, Surabhi, again. And
Thank you, Jaita.
we'll talk again.
We'll talk soon.